everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, please let us know. Boom, baby. Oh, I forgot. I'm Dr. Emily King.
Oh, I'm Courtney Allen.
I'm Devin Fortune.
I'm Dr. Ashlyn Duckwall.
Like,
now, boom. Okay, here we go.
Where we at?
Sweat is dripping.
Holy crap.
Let 'em know.
I think I see
Are
it.
you sweating?
She's sweating.
She's glittering.
She's sweating. Okay.
Women don't sweat, we glitter.
Okay.
Like vampires.
Glitter, no,
Like vampires
glisten.
in Twilight.
It's not
What?
glitter, it's glisten.
Glisten.
No, that's not right either.
No, it's glisten.
It's,
I'm sweating.
you are sweating.
Mm-hmm.
Okay, because you're
I'm
looking
not,
at the
I'm not
review
a
number.
princess. I don't sweat.
You're looking at the
Glitter.
review number
Mhm.
down there
Mhm.
on Apple Podcasts.
We're at 86, guys.
From 84 last time, which was just a week ago.
Courtney basically tackled the person who came to visit us at the clinic yesterday and said,
What?
leave us a podcast. Dr. Riley
Oh, yeah.
Aronson
Mhm.
came to the clinic, traveling from far, far away, traveling through our town. She's had a long trip. She says, you know what? I'm going to stop at All-Star Veterinary Clinic because I just want to see.
Yeah.
And so then I call you all on both Sarah. Courtney literally is like,
It's me, actually. But...
you tackled her about the
no,
review?
I called everyone.
You called everybody.
Yeah, I was like, is it an emergency?
You did say that. And then Courtney meets her and is like, but
Yeah.
just so you know, when you're in the car driving, go ahead and leave us that review.
Yeah.
Uh-huh.
Okay.
Whenever
Because
this is her, I'm sure.
Everyone I tell about the podcast, I'm like, leave us a review.
Yep.
so Dr. Riley Aronson, if you're out there, thanks for visiting
Thanks
us.
for
Yes,
visiting. That was awesome.
amazing.
It was
That
a
was
fun,
really cool.
it was just a fun distraction for
awesome.
the day.
Yeah.
Yes.
That was really cool.
Yeah.
We kind of made her into the star because she came in and she was like, I'm so sorry to bother you. And we're like, oh my
I know. We're like, wow, tell us
I
about
think
yourself.
we were fangirling about our fan.
we were
Yeah.
fangirling about the fan.
Can we
It's
have
an
your
exciting
autograph,
moment.
actually?
That was really cute. She was just so
Yeah.
cute. And she's going to do her opto residency. Good luck. Oh my
Yes.
gosh,
Yes.
that's amazing.
I know.
Colorado.
I felt bad because I was like, we don't like eyeballs, but I meant to say like we're so thankful that for you because you like
Yes.
it, you're committing
Thank
to it,
goodness.
and we have people like you to help us for those who don't like eyeballs.
I'm sure she got the
My mom
message.
always says
Yeah.
it takes all kinds to make the world go round.
That's right.
right.
God bless ophthalmologists.
God bless ophthalmologists.
And first of all, I can't believe that we're at 218 reviews on Spotify.
I know that's really cool
That's
too.
like bananas.
Spotify's a hot platform, let me tell you.
That's what I
We
right.
should have
I mean,
made our Spotify one a goal.
the goal. It was going to be too
But it was,
easy. I thought.
that's
to
true.
take care of
That's
Cincinnati.
why. That's why
I
we
mean,
did it.
we're gonna keep going. We can make new goals once we hit this other one, and
Okay.
then
When we
get
hit
to
300
decide.
We'll draw a
on
name
Whose
out of a
head's on the
hat.
chopping block next?
you draw it.
Yeah.
Oh,
That-
let's do it. Okay, and you get to draw the name out.
Yeah.
Wait,
so
what?
Okay, the next thing after
the
this
next goal.
is we're going to pull a name from one of us three is going to have to do the next
Yeah,
thing for the
that'd be
next
great.
goal.
Why don't I just choose?
Okay, well, you could
Well,
do
you
that
could.
too.
That's
if
not
you
as much
want.
fun.
Drawing out of a hat.
Sounds a little
Fine.
targeted, but that's
Yeah,
fine.
okay. Yeah, exactly. I'm like,
This
who
feels
don't
targeted.
you like that day? Devin's
Yeah.
going to show up and she's going to have like chocolate
I'm
at her
I'm
desk.
just gonna
She's
say
going to have like
briber.
Starbucks.
Yeah.
You know? Okay.
I'll let you ride my horse as much as you.
I have a horse I can
I'll
ride.
give you a cat.
And your
Ooh.
horse is spooky.
Dang it.
I'll give you rides to work so you don't have to pay for gas.
See, it's already started.
Yep. Mhm.
All right.
Okay, so we have a new review.
Mhm.
Congrats on putting together a podcast that is informative, collaborative, and entertaining. I'm VetMed adjacent, this is really cool, imaging equipment sales, and your conversations and viewpoints help me immensely. Keep doing all that you do to help pets and move the industry out of the dark ages. At Queso Papi.
Get the poppy.
I like that.
Get
name.
out of the dark
Hey.
ages. That's right.
Yeah.
I thought this is like our first adjacent
hmm
VetMed adjacent person listening, at least that we know of or commenting.
Yeah, that's
so
really
I thought
cool.
that was really cool.
But that
Very
is,
cool.
it is probably providing like that, like backroom information.
sure,
Mhm.
yeah.
Because I mean, I'm sure you learn about the industry, but you don't learn like the ins and outs of like what's happening
Yeah.
on the ground
Yep.
and like
Mhm.
what are people thinking and
But
what are their
people
challenges.
are invested in their pets and they just
yeah,
want a perspective from the other side.
Yeah.
that's
like you were
cool.
saying. That's
Well,
really cool.
So thank you.
Yeah, absolutely. I wonder if he's working or he or she is working with AI to move us out of the dark ages.
Oh, I don't know.
Okay.
Let us know. Okay.
Please go check out our social media. Instagram and TikTok at the Veterinary Roundtable. And I
Courtney's got this committed to
I was
memory.
gonna say, I hope
Okay,
she has
ready?
this. She nails it.
Okay.
Go.
So this new texting feature, folks, it's on all podcast platforms. When you hit the Veterinary Roundtable,
You gotta line it up with how she says it, like
Yeah,
the
you
video
gotta
we
do that.
made.
on all podcast platforms, when you go to our profile, I guess, and you click on an episode, it's right at the top of the page.
Right
It says
there.
send us a
We
text
should just
message.
like pull it up on the
But
screen.
if you use the texting service, you have to include your name. Otherwise, it comes through anonymous and we can't shout you out.
Yep.
So unlike reviews, your username is not attached to the text message. You have to actually put your name or whatever username you'd like to go by.
And if
Very
you don't
important.
want to, then
Ma'am.
that's fine.
Yeah.
Wow.
Heard
And
her.
if you want to be anonymous, then I mean,
Oh
that's
yeah,
cool,
oh
too.
yeah, yeah,
Yeah.
yeah.
too, but
Don't feel obligated, but
we like hearing all the names like Queso Papi.
Yes, I love
Yeah.
hearing the names. Actually, yeah.
it is kind of fun. Okay, go
Pit-
Courtney.
Go Courtney. Go Courtney.
Go.
Okay, so are we doing pits and peaks?
Sure.
Okay, who's going first?
You.
Okay.
Okay.
I feel like you always go last.
I do.
Yeah,
do,
I like
sorta,
that.
don't I? Okay. My peak is I went to AVMA.
Yeah.
And it was a blast.
You
And-
did?
What?
I didn't know.
Oh,
No,
I was like,
uh,
how did you not know?
know that?
I'm
Okay.
just like kidding.
I have a couple of peaks from AVMA. I mean, there was like so many things, but we met so many people, Harrison and I did, that took their time to come up and say hello and share feedback about the clinics page, the roundtable page, everything. It was just really refreshing. And it was so nice of them to spend time coming up and saying something. And I got to meet people and see what they were doing and what year were they in school and how many years out of vet school. And like, you know, it was like, wow, we got some good, energetic people out there.
Yeah.
Nice.
So that was really cool. I met the two veterinarians who own a mobile house call practice that invented the cozy cat thing.
Oh yeah, those are cool.
They're freaking amazing. And so I'm super excited for you guys to try those and see what you think. And she also wants me to reach back out once we do whatever we do with them,
Yeah.
because you can also use them on a small dog.
Mm.
Anyway, so
Those little
and
hoppers,
she
little chihuahuas that
yes.
want to get out. Yes.
yes,
And you literally can't do anything.
Yes.
and you
with them.
cannot do
Yeah.
anything
or
with
like
them.
keep them,
or the ones that are
you
like
will break them.
Yes. They just claw you to.
Mhm.
just keep going like this.
Yeah.
you put their hand
And
down
stop.
and they're like this.
Yes.
As soon as you like
it's so
get ready,
annoying.
they
You're
put
like,
your-
you're like playing that game.
Yes, like handsies. So that was really cool. I played golf with some neat people, and it was way too hot. My pit was way too hot.
Mm.
Is that your
And-
excuse why you didn't win?
Okay, I almost won. It was Harrison and his bum leg. I'm gonna blame it on him.
His
Um,
bum leg.
And we were
Sorry,
supposed to play
Harrison.
18 holes, but we couldn't because they wouldn't let you drive on the course. You had to stay on the cart path.
Was
And
it
I was
why?
like,
'Cause it
why
was-
the shenanigans?
Yeah.
Because they had their turf growing. They did not want their turf ruined. Meanwhile, it is really hard to only drive on the cart path and find your ball and come back. find the ball,
Yeah.
come back and find the ball and come back.
Yeah, no, thank you.
It took us forever. Like by the time we got to the fifth hole, all of us looked at each other and we were like, there's no way. We had to go the wrong direction. There's no way we're only on the fifth hole. I mean, literally, we had a debate about being on the wrong hole.
Yeah.
And I'm like, guys, I think we really should have, because none of the holes were marked. And I was like, I
Oh.
bet we were supposed to go up that way. And who was it? Shane Harrison? I think Shane was like, guys, no, we're only on the fifth hole. And I
Oh
was like,
no.
Oh, that's not
God.
fun. That's no fun at that point.
no.
So you
It
just
was
cut it off
dang.
early.
So we said, we could literally only, it took us 3 hours.
Holy
play
crap.
9 holes.
Oh, 9 holes.
Oh.
Oh.
Yeah. So I was like, we're done.
Still.
Yeah.
You're done.
We're done.
Yeah.
So anyway, that's my
Wow.
shenanigans for the week.
Okay.
Nice.
Yeah.
Good pit.
Entertaining.
My pit
That
was
her
golf.
pit. It was
Oh,
hot.
okay.
Hot.
It was
Yeah.
hot,
They're hot.
hot in Texas. Who's next?
Okay.
Don't
I'm
know.
nominating you.
My pit was I had to get up really early this morning and I'm a sleeper. So mama tired. But that's okay. They'll be fine. And my peak is, shall I say it a third time? I saw my best friends last weekend. And then
That's
I'll be done
good.
with that one.
You good. Well, that's good.
But no, it was a battery charger. So I needed that because we've been really busy as everyone is in the summer on the weekends. Not really, just a lot going on. And so sometimes you just need to reboost when you're busy. And that's the way we did it.
Right. That's awesome.
Nice.
I'm glad you got to see them.
Thanks. My peak is that someone really close to me just let me know that they are expecting what?
That's
like, it
amazing.
It just happened.
It literally
just happened,
like,
folks.
like
Just
right
happened.
before we started filming, they just let me know that they are expecting a baby and they had some difficulties getting pregnant. So it's just very exciting. We're very
that's
happy for
awesome.
them.
Yay.
So
That's very
that's exciting. And then my pit, I don't really have a pit this week.
Okay.
I know Harrison gets mad when we don't have pits. But you guys are gonna make fun of me because it's about Walter.
Okay.
She's already laughing. I know.
It was the tone.
No,
She was
it's
like,
the
you
way
guys
she
are going to
said
make
it.
fun
She
of
was
me.
like, you're going to make fun of me.
Yeah.
It's about Walter.
Shall
What
I
happened to
continue?
Walter? What do you have
Nothing
pit about Walter?
happened. It's just he's my child, and I've been really busy lately, and he misses me so much. And no, he really does.
Does he not spend time with you at night?
No, he does, but like
It's not the same
he's
kind
a
of time.
cat. He likes
He's sleeping too at night.
Well, he's a cat. He likes his distance. So when he's super clingy, you know that he misses me. I sent her a picture the other night, but he fell asleep. We were going to bed, but he fell asleep on my arm right here and slept there the entire night.
Aww.
was so
That's the best,
cute.
though.
But I know it's so sweet, but it just kind of breaks my heart
Yeah.
in the best way possible. But
That's okay. The
And
nice thing is
then-
animals are pretty forgiving.
I know. And then we have a glass door, like a storm door. Or yeah, whatever. And whenever I drive out of the driveway, he's just like sitting there and his little face is pressed. It's so sad. I'm not even kidding. Every day I drive out of the driveway and he's sitting there watching me.
Will you please videotape this?
I will. I think about it
Yeah.
every morning.
And
And
Oh
we
my
put the little
God.
violin over it.
Okay, because I loved the video of him sitting there watching
Yeah.
the food.
Oh my gosh, we haven't posted it yet, but I did the trend where like you leave food somewhere and leave and see how your pet reacts, and it's pretty good.
It's amazing.
Yeah.
I mean, because
The
just his
eyes.
facial expression, and
I've
then
watched it 20 times.
you know he's like he turns around to totally watch you. Like, all right, it's good now, and then this is amazing. It's
you can
great.
see his entire body sniffing.
Okay,
It
so
was
I need
funny.
the video then of
I
you.
will.
Yes,
for sure.
leaving
Mm-hmm.
the house
I will
because that's amazing.
Yeah. tomorrow morning.
Somebody said in a lecture I was giving yesterday, the other guy before me was giving a lecture, and he was like, you know, it sounds really bad, but when you say like my cat's like a cat dog, it's like as if a cat's not enough. Do you know what I mean? Like,
Yeah.
like the
Yeah.
cat can't be cool enough as just
Yeah.
a cat. It has to be a cat dog.
He is kind of like a little dog, though.
See though, you're
Yeah.
Yeah.
you're minimizing his
he's
catness.
just
No, I'm
a-
not.
He is totally enough to be a cat.
No,
Like
I know.
he's the cat of all cats.
Yeah, he is.
Not a dog cat.
Mm-hmm.
We shouldn't call him a dog cat, even because
is
that's saying
himself.
dogs are better than cats, and so
Yep.
cats would want to be a
Just an
dog to be
amazing cat.
cool.
Yeah,
Sorry.
absolutely. Every dog wants to be Walter.
See, so maybe we need to be calling
Yeah.
dogs
Cats.
cat dogs.
I like your.
I have owners that say that, though. They'll come in. It's
Yeah.
usually the small dogs that sleep on backs of couches and
Honestly,
stuff like
Mitzi.
that.
Mitzi was a cat dog.
yeah. So I do have owners that do the same thing in
But
reverse.
is the implication that that's a good thing, right?
I think so.
You
Mitzi
think
was
so?
Just like,
yeah, I don't think it's a bad tone.
Or it's because they're describing because cats are like generally
Perchy.
independent.
Oh,
And so like if their
Yeah,
dogs are like more
quiet and-
standoffish, they'll be like, it's more like a cat because cats
Yeah.
are usually like, bleh.
yeah.
Yeah.
Like I want to do my own thing. Don't bother me, please, until I'm ready to be bothered.
Yeah, they still love their dog.
Yeah, I
They
think
just
it's like
good.
that. That's how I think
fair
of it.
enough. Fair enough.
Yeah.
Okay.
Yeah.
All right,
Oh,
Courtney,
it's
what you
my
got?
turn. Okay, I'll start with my peak. I have a
Mhm.
lot of pits.
Oh, great.
Oh, okay.
I'll start with my peak. I really love my job, but I like having time off.
I thought this was your peak.
I am talking about my peak.
Okay.
No, I'm just saying, I feel like a lot of my peaks are like, I didn't have to work. But like, I love my job. But like, I had a whole week off of work. I went to Kentucky, which doesn't seem like anything crazy. My mom does yoga retreats every year. She's a yoga instructor. And so, I mean, my dad and I go and we clean and we cook and we do all that. But it was just nice having some time away. And I got to enjoy the pool. And so it was really fun. And the weather was really nice.
That's beautiful.
And I came like one-on-one with a groundhog.
Ooh.
Yeah.
Its name is Timothy.
His name is Timothy. I have a lot of pictures.
and
and
it
videos
was
of him.
throwing hands at
I
the air.
literally have videos and he's like,
Nice.
okay, anyway.
In Kentucky. with the groundhog.
It was awesome.
Should I just do one pit?
Well, start and let's see what it is.
I'll
Yeah.
do two pit. Okay.
Okay.
My
Whatever makes
first
you feel
pit
better.
is my husband texted me while I was at work today. I left my dog at home with him because he worked from home. He wouldn't eat this morning, which is a battle we've been dealing with for 2 weeks. He threw up on the stairs. There was toys in it. And then a few hours later, still wouldn't eat. And I was like, well, did you try to hand feed him? Which seems extreme, but it's just whatever. Just leave it alone. And he didn't try to. So I was like, okay, whatever. I'll just feed him when I get home. And then I get a text when I'm on my way here. He just had explosive diarrhea, like liquid. And I was like, so we're just getting, he's a very sensitive guy. I think I don't know.
I'll see you at work tomorrow.
What I
Sounds like we have to go back to
So
biome.
that's really exciting.
Oh, buddy.
I don't want to talk about it.
He's a blue pity.
So that's great. My second pit is about her. She's leaving me.
Oh, it's kind of one of my peaks, but I wasn't going to talk about it.
Awkward turtle. Okay, it's in peaks for different reasons.
Okay,
but we
fair
do
enough.
tech appointments together every Thursday, and I was super against tech appointments for a really long time. I hated them. I didn't want to be on them. I had to be like forced to do them, whatever. And now I love them because Devin and I have we work 7 to 2 on Thursdays, and it's just her and I in the back hallway, and we have the time of our lives, and she's not going to do it anymore.
It's when they talk shit about us, King.
Yeah, I know. That's what I was going to say. No wonder. Okay.
She's just moving to a different area of the clinic, but I'm really sad.
But it's good for her because she's
Yes.
becoming a technician.
Yeah.
Butterfly. My beautiful
I'm
butterfly.
not happy about it right now, but I will be.
Mm.
Okay, and then my third peak bleeds into, or my third pit.
Wait, I have another peek. Okay, because mine was boring and I'm just copping out. On Tuesday, it was my birthday, but I spent it with Helen and we napped together and then went to Target together.
Yay. And she looks so cute.
Helen is her daughter, if you don't know.
Yes, that's my baby girl.
Oh my god.
So anyway, that was really fun.
Okay.
That's a good
Okay.
peak. But my pit kind of leads into case collections, I guess, or it's just I'm touching on last week because I was not here.
Mhm.
Nobody said I wasn't here.
We did when the
We
guest.
did prior to that. But
Yeah, I guess we did on the guest introduction and then the
That's
guest
what I
thing
said.
didn't
And
work.
I just forgot about me.
Yeah.
Anyway, I was not here when Dr. Duckwall talked about the cat that we lost. She mentioned that it hit me pretty hard. But I just thought it was important to circle back because as a technician in that situation, it was very, very, very hard because, I mean, we deal with death all the time. But when it's, I think, okay, so one of the things is adrenaline rush. When all that chaos happens, you're
Mhm.
like, oh my God. And then when it stops, you break, I guess, or it all hits you at
Yeah.
once. But also it was just, like I said, I've had patients die in my arms before. I've held them when the owners aren't there for euthanasias. I've dealt with a lot of loss, but when you have a completely healthy cat who comes in for a stupid little wound and then they just pass and then you have to tell the owner, it was just, it was really hard. And to be completely vulnerable. So everything happened, whatever. She explained it all. She took the cat back in to see the owner, so the owner could say goodbye and whatnot. And I could not even go back in the room. I had to go to one of our leadership offices, and I lost it. Could not breathe, cry, and it was really hard.
Yeah.
So, and then I gathered myself again, but it was, and I think I have a little PTSD now. It happened today a little bit. I joked it off, but now, recently, yesterday was my first day back at work after a week. But now every time a patient freaks out after treatment, I get a little panicky inside because I'm just scared a little bit, which will pass. But I'm also dealing with that now too. So
Cats are so unpredictable, and
Yeah.
they like to just suddenly die like that. Unfortunately.
yeah,
Yep.
yeah. So
And
I'm a little scarred
Yeah.
for sure. So that
Yeah,
was
me too, for sure.
that was really, really, really hard on
It's
me.
traumatic.
Well, the thing is, I'd like to be able to tell you it'll never happen again, but
You never know.
you never know.
Well, and that's what I said. I don't know if I said it to one of you, but I was like, you always talk about we joke-ish about it. We're like, oh, you might kill the cat, or don't stress the cat out, it might die. And then it actually happens. You're like, oh my God.
Yeah.
yeah.
Sorry.
It's just a thing you say.
No,
Because
I
cats
know.
are so sensitive.
Yes.
Yeah.
they
And then
are
when
so
it actually
sensitive.
happens, you're like, holy crap.
Yeah.
That was that. And I mean, he died in my arms, which made it even.
Yeah.
I'm not taking away her feelings by any means or anybody that was involved in it, but
He's lucky to be in
it
your
was,
arms.
yeah, that was one of the worst things I've been through for sure. It's not fun.
not a fun experience.
No.
Mm.
And it's okay to
Understandable.
feel your feelings. Don't push down your feelings.
Mm.
That's all I got.
Yeah.
I'm sorry to dampen the mood.
No, you're okay.
No,
Um,
that's an appropriate pit.
Before we move on to listener inquiries, I just have one little circle back from last week too. So I know we talked about pet peeves.
Yes.
And I said that I had been working on paying attention to what my pet peeves are and writing them down because I know I have pet peeves.
Okay.
So over the past week, one immediately came to mind on my way home from last podcast, bikers, like cyclists on the road. They make me so mad. And
What?
okay.
They do have a right to be there.
No, I know, but like honestly, more often than not, there is a sidewalk off the
That they
road
could be
and
on.
they're still on the road.
Yeah.
Or when like they have to know that I'm stuck behind them and like traffic is
Backing up.
yes. And then we pass a neighborhood and there's the shoulder for them to get off so we can all pass, but they don't. They stay in like the main lane and it just makes me so mad. As you can tell.
I get it.
So that's a big one.
Okay.
The second main one is like a lot of applications open on phones. I don't know if it's a millennial thing,
Well, I don't know. What am I?
but whenever I get on my mom's phone, it's like I can be forced closing her applications for like an hour.
Yeah, I've
How
got
many
quite
do
a
you
few
have?
open. I've got quite a few open.
Yeah, like that. Stop, please.
Yep.
That's a lot. That's really
That's
bad.
every app on her phone.
Like,
do you
think
know
about-
that? Do you know that runs actually down your phone?
Yeah.
I don't think that's
Automatically?
true. Harrison Branch, is that true?
She's still scrolling.
All that stuff is running in the background, King. Whatever.
He
Harrison.
said it does.
No,
Okay.
no, no. It's like fingers on a chalkboard for Devin. I can just
Yeah.
be like,
No,
Go back the other
that
way.
is hard to watch. I have like
No, how about okay? So how do you feel about your
let's see my phone. I have text message. That's all.
What about the Safari app when you can pull up a tab and you're Googling something or whatever
Yeah.
internet browser
Yeah,
you
yeah.
use?
I'm really organized with that too. I only have
Oh, I have
6.
I don't
Okay, I'm
today
gonna tell
just
you what
because
And they're all like I'm saving them for a specific purpose.
I'm going to tell you what I have.
Okay.
Let's see how many I have.
yeah, no, in my other scenario, I had like 300 something
You ready?
open. Well, you can say what's the number at the bottom.
It says 340 tabs.
Yep. That's how I am too. And now occasionally when I'm bored, I'll go through and start.
Oh, what was that
crazy.
looking at? Yeah, look at
Like
that.
the first
Okay.
one's probably from like 2015.
Mine?
Yeah.
Is that what it said?
No, but it's just probably like 10 years ago.
That's 20 years ago.
That's
No.
crazy.
That's right. I know. I hear you. I hear you.
Okay. it'll look
Okay,
bad, but-
onward and upward, folks. Here we go.
Don't bite near Devin.
Please.
Don't bite near Devin. Oh, God.
All right, who wants to do the first one?
I'll do it.
Okay.
Let's do it.
Okay. I have to say I'm very disappointed by this quote from the nutrition episode. Quote unquote, I have a question. So the big 3, Royal Canin, Hills Science Diet, Purina, are those your go-to personally? When clients are like, what are your brands you recommend? Do you for sure go to those? Because that's what we've been taught. And I was just curious if blah, 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 blah. I personally hear and see so much about how vets and their staff couldn't possibly be indoctrinated by any brand. But there it is. And it's right on your podcast in black and white. You're admitting that you and other vets and vet staff are taught to reach for a brand, and a certified nutritionist is confirming that treating the patient with ingredient-specific nutrition is key. I'm just curious how this will actually change how you'll make nutrition suggestions in the future, or if you're likely to still recommend the big 3. Anonymous.
Okay, so I think it's a good question. I think it's a good like kind of challenge and push
Sure.
to
Yeah.
open up our minds.
Yeah, absolutely.
I will say that I do think that the big 3 are most commonly talked about, recommended is one because of their variability. And a lot of times too, number 2, they have their big corporate, they have money. They have money to do research. And a lot of these smaller companies aren't going to have that ability to have a lot of research done, science-based behind it. And we are a field that is science-based, unless you're in the holistic side, but that's another story.
Right.
So that's kind of where my first thought was, or argument back was, just to kind of challenge that thought is, well, yeah, that's true. We talk about them or recommend them a lot. However, there's a reason for it. It's not just because we're sitting in there was never a time in class where I'm like, you need to just talk about these 3 brands of food and that's it.
Oh, yeah. That was
Good point.
never said.
No,
Ever.
no. But then also in the rest of the podcast, we talk about all the other brands that are good to recommend for different reasons. And truly over time, I've come to find other brands outside of those big 3 because like this anonymous listener had suggested, a lot of times those are the only ones that are recommended when asked by clients. And so I realized that I was being repetitive in my response. I still believe in them, but I wanted to have other options in case an owner would come to me and say they had a prejudice against them for whatever reason. Because I do think there are a lot of clients that say they want to stick away from those for whatever reason that may be.
Right.
There's a laundry list that could be.
Mm-hmm.
So I've started to build my own list based off of how my patients do on it, based off, again, what is offered. But I mean, a lot of smaller companies don't have the prescription diets we need for a lot of our cases that have diseases that need very, very specific things.
Mm-hmm.
And if an owner wants to go outside of that, then you're talking about homemade meals, which is fine as well, but you're still getting involved with, I recommend a nutritionist because you have to make sure it's correct.
Right.
Balance.
So, yes, I will only speak for my opinion. Yes, I recommend the big three the majority of the time, but it's because I also believe in their products and the science that has backed them.
Mm-hmm.
However, I have also have other options too that I do actually voice and talk about with clients. So
You're not doing it because you were told to.
exactly. It's
Absolutely.
not because that's the only thing we were told to.
Yeah, I think that for us in school, anytime you think of these brands, the way they market is just by being in front of people all the time, right?
Mhm.
So like you're like, okay, I need something, and somebody, it's like a certain kind of marketing, and then when the need arises, people think, oh, Hills. So I think that was a lot of it for us in veterinary schools, that you're in front of those brands all the time. Like those are just coming up different things. They sponsor this, they sponsor that, they do
Sure.
whatever, they do this, they do that. So again, it's just in the forefront of your thinking. I think that there are more food companies now than when I graduated from school, and food companies that are doing good things, like Winwood Foods. We talked about them on I don't remember when it was, a couple podcasts ago. I think from a cost perspective, that's also something that is factored into our decision making. Yeah, I could want to recommend Winwood Food for a specific disease condition, but if the owner can't afford it, what's my next best option? Probably one of these three, just because the price per packaging is probably slightly less. So I don't know. I mean, I think that's a factor. I think there's less of the. Let me back up. I think that the big three, when you don't know what you should be recommending, you know what those three are doing.
They're safety nets.
And right.
Because you know
So
about
like
them.
if you have to go explore what some other company is doing and you don't have the time to figure it out because they don't have the marketing that's out there teaching about it, then you don't know. So like Farmer's Dog, they're out there now marketing and teaching people about some more specific formulas. Blue Buffalo, out there. They had to do that, where they went out there in order to teach people what they had available.
Yeah.
So I think as more and more people do that, then you learn more and more things about the diets, and therefore then become more comfortable. I don't think it's because we're not willing
No, I don't
to
think
feed
so.
those foods. You don't know anything about them.
Yeah.
And how do you even know what exists? Like there's
Right.
too many there's too many out
There's
there.
so
It's
many dog
overwhelming.
foods.
So I don't think it's necessarily that you're in love with those three. You know what I'm
There's no
saying?
secret code. There's no secret like money getting given under the table to
Right. They're
not making
veterinarians.
commission off of saying those
no,
things,
no,
yes.
it's completely separate.
Right.
Mm-hmm.
So
Anyway, great question.
We
though.
trust the food.
thank you for challenging us.
Yes.
This next one is going off of the case that Dr. Duckwall talked about last week, the Goldendoodle that had a thoracotomy. With the Goldendoodle case, I would definitely run a Miravista and test for blasto if clinical signs don't improve with the antibiotics. I wonder if being sick from the dog attack suppressed her immune system to allow for a fungal infection like blasto, especially with the lymphing. Lots of love for the podcast from Dr. Jordan, your neighbor on the south side in Greenwood.
Sorry, I didn't realize they were in Greenwood. That's cool.
Yeah.
Dr. Jordan, thanks. That's
Welcome.
awesome.
So
What did you guys do? Follow up on that case?
yes. So I'm waiting on some information, but there has been updates. She did not respond to the first course of antibiotics that was susceptible. So we highly recommended x-rays, chest x-rays. And this was 48 hours after I had seen her for ADR. Various reasons, owner declined. And so a second antibiotic that was also susceptible was then started. And so she went through the weekend. Followed up with owner on Monday. She was still ADR. Highly recommended thoracic x-rays. She said the owner said she was panting more, but she was not having abdominal effort. And the owner was unfortunately going out of town. And so the dog was going to be staying with her relative. And so was declined x-rays again on Monday. So I saw the dog Wednesday, and unfortunately the dog had now acquired a large, hot, firm subcutaneous swelling, or it could be muscle, we're not quite sure, on the right side where the original attack was and where the original pleural effusion was. So she still had a fever. She was limping, and actually after watching her, it was a very, very small limp, and it was actually like the gait, I think, was
hitting the swelling.
yes, it was coinciding with the swelling on the
Her
side.
elbow, like, I mean, it hit right on the swelling.
Yeah, and it actually might have been involving the muscle because of how
Mhm.
deep it was, and
Sure.
that could be why too.
Sure, yeah.
So we did chest x-rays. Unfortunately, her entire right side of her chest was full of pleural effusion again. And so we had to, I was on the phone with different referral centers, mostly the one that she had originally gone to for the surgery because that's ideal. But at the time, their CT scanner was down. And that was the next step because the next option was literally exploring the dog's chest on both sides. And owner said, I really don't want to do that for my dog, which is, I can understand, right? That's pretty extreme surgery. Well, long story short, after calling places, whatever, the CT scanner got fixed because it was actually getting maintenance on when I had originally called. And so we sent the dog down there to the referral center. That was the original surgery place. And that is where I have to get filled in. I don't know exactly what happened. I was told, unfortunately, the dog did not make it, but I do not know what had been
Like the
done
discussions
yet.
and stuff.
They
So
weren't done with the records quite
yeah,
yet.
yeah. So we will update again next podcast, but unfortunately, it sounds like it was not a good ending all around, which it's weird. Like speaking with the referral center, it's weird that it was like 3 weeks after the original attack, and she had been doing well. They had susceptibility testing, but then the concern is like, was there something that was walled off or hidden in the deeper tissues? And then obviously opportunistic like the infection just came back. Did it never just completely clear in the first place? Was there something else in there? And that was the purpose of the CT, I think.
Sure.
Yeah. But
unfortunately, the dog, when she was with us, she was coughing now. She had some nasal discharge. She didn't look good.
Yeah. What to Dr. Jordan's point, what made you guys think, okay, we don't need to think about blasto?
Just the sheer history of knowing there was literally a dog attack, and she had this issue two weeks ago, 2.5 weeks ago. So it really, sure, I can't. And I told the owner this when I first saw the pet again. I was like, I don't want to be too narrow-minded because you have this limp. So we talked about immune-mediated disease and the fever. She was breathing fine at the time. So I was like, maybe it's not in the chest. Right. And that's when we had checked in subsequent days of like, still chest x-rays would be the preferred first option. But we talked about forelimb x-rays too. And, if everything looks good, we have to start searching for other weird stuff.
Sure.
So I'm sure blasto eventually
would have come on the list.
Exactly. But it just was too like, walks like a duck, quacks like a duck, like the coincidence of the history.
And with the antibiotic, with the susceptibility testing, like, with the culture. Yeah. So, I mean, you pretty much have your answer.
Right.
So it's like, dang.
Well, because on Wednesday when she rechecked her in person, after talking to the owner via text and phone call, she originally came in for forelimb x-rays. Like that was our plan that day, was to do chest and forelimb.
Yeah, both of them.
But then we saw the swelling and Dr. Duckwall was like, no.
Yeah, the swelling came up within 24 hours.
Like I said, the limp was not overriding what was happening.
And the limp really wasn't that bad either. But anyway. So
it's an interesting case.
Yeah.
Why her immune system was doing that. Okay.
Yeah.
Okay. Icebergers.
Okay.
Onward and upward.
What do you want to do?
Oh my gosh. I was like, wait, are we on? Okay, we've got listener inquiries, icebreakers, and then listener question. Okay, I'm on the same page now. I was very confused.
Got a lot to unpack.
Hi,
here.
first, I would like to say that I love y'all's podcast. I was actually listening to episode 27 about FELV and wanted to pick y'all's brain. I know that it's recommended to do a PCR test to confirm disease after a positive SNAP test. But in a low-cost area with a high volume of feral cats, we try to encourage our local trap, neuter, release people to triple test because obviously we want to limit the spread of communicable diseases like FELV. Is it ethical to euthanize cats only based on a positive SNAP test when TNR people can't or won't pay for PCR screening? Thank you so much for all you do and for your time at Jenna Killingsworth.
That's a great question.
Yeah. So her and I were kind of talking about this earlier, and I said that if they do 3 back-to-back snap tests, I feel like the chances of all 3 of those being false positives is low.
Yeah, that's a good point.
So if the cat is truly FELV positive and they can't pay for PCR screening, I feel like
or treatment.
Yeah, I feel like
Well, the problem is the cats can't be brought inside, so you're spreading the disease.
Yeah, I
even
feel
though
like
it's not,
it's-
the disease isn't killing the cat.
But
Right?
yeah, that's what
yeah,
you're getting to.
I feel like it's
Yeah.
ethical. Certainly not
Humane.
unethical.
Euthanasia.
So we're not spreading that. The cat
Yeah.
isn't suffering.
Because the only option you have is to bring the cat inside.
Yeah.
Right.
Now, if it's just one snap test, I would definitely say retest it
Yeah.
and
Yeah.
do more. But
Yeah, I wouldn't rely on just one. I would.
yeah,
do
I mean, 3 is. I mean, I would say 1.
maybe make sure they're
one,
from different batches or
No, I would just do 1 12 weeks from the first one.
yeah.
Yeah.
But maybe they're doing them. Did they say how
I don't think
frequently?
they
They
said
didn't
how
say the
spread
time
apart.
frame, but
I mean, because then, I mean, that's what they, I mean, isn't that what the research shows is like 1, if it's positive 12 weeks after, then it's,
So then do you
Yeah.
have to keep
And
that
then you do
cat
the
Well,
PCR
inside?
it's the
test.
age
Isolated?
too. If they're kittens, you need to wait till they're older 6 months, over 6 months of age to confirm it because of the maternal antibodies, right?
that's
Yes.
FIV.
That's FIV. Yeah. Okay. Okay.
I
Yeah.
was gonna say
Yeah.
you've said that before, but
Yeah.
So, I mean, but no, I guess to answer the question, no, there's no way to prevent the spread of the disease.
Right.
Yeah.
You have to stop the source.
so yes, it is ethical.
Well, and we use PCR when we can do it, more so to know if it's like the progressive form, like
Or
how
the regressive.
bad
You're
is
right.
the disease.
Exactly.
So, yeah,
but
I
if
think
you
it's
can't do any of that, then
Yeah.
right. I
It's a
think
really
it's
good
ethical,
question.
especially with the field, like the trap neuter release, like the
Yeah.
purpose of it.
Yeah.
If that's, I mean, if that's where you're at, like with the client, then I would be like, no, but this
Right.
purpose,
Yeah.
Sure.
Assuming the client has that choice, which I would
Right.
hope
Yeah.
yeah.
they have control of that. So,
Mm-hmm.
Yep.
great
Good
question.
Yeah.
I love it.
Love it, love it, love it.
Okay, next one. This is under icebreakers still. My vet did a neuter of my 1 year, 3-month-old golden retriever. We have fostered and never experienced a male neuter past puberty. 7 days into the neuter, he developed a significant scrotal seroma. He had large space to fill and it filled as much as possible. We were not educated on options for scrotal removal or avoiding this. He is pretty high energy, so now we are applying heat, giving him a lot of gabapentin and trazodone to knock him out. We've seen some improvement of the 4 to 5 days, but obviously this is not something that we can continue doing for very long. What do you recommend for adult male neuters to avoid this? What surgery techniques should we ask vets about to improve post-op outcomes? We don't want to do another surgery, and no draining can be pretty much useless. So how do you recommend treating it if it does happen? Anonymous.
A scrotal ablation.
That's right. You cut it all out. You just toop, 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 toop.
I feel like that should just be included with every neuter.
No, I don't
It's
think
no,
so.
it's a more extreme
yeah.
procedure.
Yeah.
So, and there's more of like you're taking away a lot of skin. So there's
Yeah.
more tension there, which can be more of complications
Detrimental.
post-op. Yeah.
So, I mean, I think that, don't drain it. That's just, you're just poking bacteria potentially into the
Causing more
hematoma. So you
problems.
could just set up an abscess. I mean, most scrotal hematomas are going to go away on their own.
Yeah.
If you
Mhm.
can give it enough time.
Yeah.
Most. There are some that are
It just takes time, but
bananas. Like,
Yeah.
I mean,
there are ones that are so big you have to do a scrotal ablation
Right.
because the dog is painful.
right.
We had a German Shepherd and it was like cantaloupes.
yeah, I mean, like sometimes
Like, I've never
you
seen it
don't-
that big in my life.
Yeah.
It was insane.
The only thing that would be like when you,
Rest.
yeah.
Is that where you're going?
Mm-hmm.
That's what I was. Bless
Bless
you.
you.
Sorry.
That's what I was wondering is like what the conversation was post-op, like with-
Pressure, rest. the
yeah,
wraps,
like
the
what was their
icing.
discharge instructions? Like, did they go over with the owners,
Yeah.
like how important rest is and how important icing is? And
Yeah.
Yeah, it doesn't
You
look like he was started
started
gabapentin.
something new-ish. Like
Yeah.
I mean, it's recent to you doing surgery, but she has been wrapping the scrotums
Yeah.
like directly after a neuter.
Yeah.
And we leave them on as long as we possibly can because our neuters go home same day most of the time. So
Just
she
provides
leaves them on.
compression.
Yeah. And so she just helps compress it a little bit more. So I think that's cool too. That's a good little option.
It's been a good trick
Mhm.
Yeah.
because we were having some hematomas and we
Swelling.
tried to look
Mhm.
into what we could fix. I don't think it's wrong to have the discussion of an ablation with like
Mhm.
Mhm.
the Great Danes
Sure.
or
German Shepherd.
yeah, especially the
Yeah.
ones that you're keeping neuter or intact longer
Long,
and they're
yeah,
more developed and
Mhm.
everything. I don't think it's wrong to have that conversation.
I agree.
I would still prefer not to do it when there's no problem
Sure.
and just try to focus on the recovery, but
Mm-hmm.
that's
Yeah.
just me.
The bigger the balls, the bigger the problem.
The bigger the space.
Put that on the wall.
Oh my god,
Yeah.
that's hilarious.
I'm sorry. Those are frustrating though.
Yeah,
I
they're
had one
very-
in a Greater Swiss Mountain Dog and extra large breed. Obviously he was older and he was a puppy still. He was rambunctious and that was frustrating for the owners. They were very just honest and saying we're gating him in our kitchen and he's hates that. And of course I don't think many owners love knowing they're just drugging their dog to keep them quiet either. But fortunately that's what we had to do. And then they were really good at the heat and ice and
But keeping a dog quiet is not easy.
no, I felt
At
bad.
all.
Yeah.
And the cone, they have to have the cone on. And sorry, that sucks, but
I hope
it is
it heals on its
complication.
own. It sounds like
Well,
it's
hopefully it'll
getting
resolve
better.
on its own.
Yeah.
Yeah,
Yeah.
I agree.
Bringing
Okay.
back a segment here.
What'd you say?
So we're bringing back a
Bring
segment.
it
We haven't
back,
done
bring
this
it
in a
back.
few episodes.
Yeah.
Well, because we got some trending topics.
The nationwide pet insurance situation.
Is pretty hot topic right now.
Yeah.
Um,
You were exposed to it a little bit down in Houston,
Yeah.
Texas.
yeah, a little bit. I
Mhm.
mean, Nationwide was still there.
Interesting.
Wouldn't you love to be that person in the booth?
Yeah.
But I think that the thing that kind of like was like, wow, they said, well, veterinary care is too expensive. So we're going to, once these certain policies are up for renewal, we're not renewing them. And I think it was like 100,000 policies or something.
Mm-hmm.
So then those aren't getting renewed this summer into spring of next year, I think, or like a year from between now and a year from now, because the company can't afford to continue to do it. Apparently is what it seems like.
Yikes.
So
Interesting.
Pumpkin
Yeah.
and Embark, I think is another one,
Yeah.
are offering, like consultations to say, hey, if this applies to you, to one of your pets that you
Smart.
might be losing,
Yeah.
care, please call us. We can walk you through like what we think, how we can help you. Basically.
It's interesting they wouldn't just try to increase the price of the policies.
They
first.
have been. Their deductibles have been going up because APC had nationwide
Yeah.
and her deductible like skyrocketed and she was like, nope, I'm done. Because it got more expensive than vet care itself. So they tried. I think they tried.
Yeah.
Well, I mean, if you
increase that.
look at some of these procedures, I mean, $10,000.
Yeah.
I mean, we're talking about potentially like CCLs, which are a dime a dozen.
Yeah.
So like, I can see where maybe it's becoming a problem.
Oh yeah,
It just
I'm
sucks that
sure.
they're like, sorry, we're dropping you.
Yeah.
Oh gosh,
like-
yeah. Or like,
I don't
now I don't know. We haven't talked to Nationwide, right? So like, I don't know. Does Nationwide talk to that person, that policy, and say you can stay on? You just need to move to this policy.
Yeah.
Or are they like,
Yeah.
nope, I'm never touching your dog again?
Right.
I don't know.
Yeah.
I don't know the piece of that puzzle.
Yeah,
I don't know.
So, I mean, if you don't have the money, you don't have the money. You can't do anything about it really, but it still sucks.
Yeah.
Yeah. That's a bummer.
Mm-hmm.
I'd be ticked
Yeah.
If I was one
As
of
a
those people.
consumer,
Yeah.
as a consumer.
No clients have said anything to me yet, but we shall see.
Very interesting.
already that's all for that.
Okay.
Okie dokie.
Are we discussing cases?
Listen, well, we kind of did discuss cases
Yeah,
already.
okay.
So,
Oh, I do need to follow up on the golden retriever though.
okay.
Remember the last one with the eyes?
Oh, yeah, you do. 'cause we
Okay,
weren't
so
gonna
that
talk
can be
about
the
that.
case.
Yeah.
So he's a 2-year-old male neuter golden retriever that I saw for vomiting, and it was a new client, new patient. So we just focused on the GI stuff, but on initial exam, I'm like, gosh, his eyes. And even my room assistant, Whitney, was like, his eyes look like puppy eyes. I'm like, okay. So I go in and they look like bug-eyed. So the eyeball, the globes look like they're out a little bit, almost like pugs, where
Yeah.
you can see the whites of it. And I'm like, gosh. And me and the owner are just like kind of joking about it. I'm like, wow, he's got really cute, just like those sad eyes. And I'm looking, I'm like, they're just really big. It's
They're like coming at us.
I'm thinking in my head, like, this isn't normal.
Yeah.
But the globes were quiet. They weren't red. He wasn't squinting. There's no like obvious immediate sign of pain or discomfort. And so we talked about the eyes, but then kind of skirted to the GI tract. And obviously that was our focus. So I made what is the word? I was intentional of calling to check in. I think it was like 48 hours later to speak to the owner because I really wanted to bring up the eyeballs. And I also had talked to obviously colleagues too and kind of showed them and talked about it. And we had seen some cases in the clinic as well. So I knew in my gut that was probably what it was, but I didn't feel comfortable just saying yeah to the owner by the way,
This is what it is.
exactly. So I called to check in on the GI stuff. He was doing great. And the conversation, I just remember she's like, well, thanks for calling. And I was like, so I just wanted to talk to you also about the eyes. I know we were joking about it. And anyway, so his eyes mimicked what I believe is extraocular myositis. So essentially the muscles behind the eye, it's usually either idiopathic or immune-mediated disease where the muscles get inflamed, which creates that like bugginess of the eyeballs. And they're non-painful. There's no other signs, essentially. And but what I found is like if you just don't do anything, you can create like a permanent strabismus, so like a lazy eye. And that's because the muscles will atrophy over time. And so I was like, I really need to I'd be remiss if you don't come back to us, because she had a different vet actually. And I was like, I just wanted to bring this up. This is what it mimics. I would really like, or I'd recommend we do a steroid trial because they usually respond great to it after his GI tract is done. And so she really appreciated me bringing it up because she hadn't heard it before. And she originally was like, yeah, I'd be, willing to do the steroid. And I was like, well, let me just call you back in a week and make sure he's back to normal. Right. So we reached out, Courtney did, and he was back to normal. And we're like, okay, we'd like to, start with the steroid and see how his eyes do. And they had decided not to pursue that right now. So bummer, but I at least feel like I did the best that I could for that patient.
Absolutely.
And she said maybe in the future, but
interesting.
When he has strabismus.
Or they're concerned about how his eyes look. Or somebody else says the dog's eyes look weird.
Yeah.
Until somebody else says it. Yeah.
Huh.
That's fine. That's fine.
I know.
You did your job.
Yes.
What,
you did what else can you do?
Oh,
and I think that's a really good point to bring up, is that there's a lot of times where this is what needs to happen.
Yeah.
And people won't do it. And you're like, oh, it just kills you because like
it's a fixable issue.
Yeah.
And so it's very frustrating, but you don't own the animal.
Well, it's fixable now, but then later down the road when they're like, oh, well, you're having it again, you're like, it's too
I think the biggest thing maybe for this disease is that it's not painful. And he's always been like this for the 2 years.
Right.
So I think to the owners, there's like no urgency is maybe how I would.
Oh, I would see that.
Yeah. He's been like this. Why do something different? He's fine.
Yeah. This is a new vet. We've never seen them before.
Right.
Yeah. So anyway.
Yeah, it's too bad because he, would look normal too.
I know. Well, maybe they like the bug eyes, I guess. I don't know.
Huh. That's very interesting.
Yeah. It's golden retrievers. It's common in golden retrievers.
Yeah. If you VIN it or Google it, there.
Picture. And it's like, woo.
Yeah. So pugs have permanent inflamed muscles. I'm just kidding.
No.
I'm just kidding. That's just how they're born.
Yeah.
That's just how they're born.
That breed.
That's right. Exactly.
Okay. Who hasn't read something yet?
I think we all have. But I can do it, I guess.
Okay, hit us.
Have fun with sure. Yeah. Okay. Oh, yeah. Okay. Anyway, here we go. Hello, fellow vet med peeps. I am a small animal GP veterinarian practicing in Florida, 5 years out. I'm coming off of a 12-week maternity leave, baby boy number 2, congratulations, and excited to get back into the thick of vet med. This podcast is great, and I love the energy you all bring to the roundtable. My questions are related to surgery and how to juggle mom life and doctor life. I've become very proficient in soft tissue surgery and limb/digit amps. Did my first PU, TICA, LBO, and anal sac ulectomy right before going on maternity leave and looking to expand surgical skills. Currently, I'm looking into endoscopy and orthopedics, MPLs, lateral sutures, TPLOs, etc. My first question is, what advice do you have for a newer but kind of seasoned grad taking this next step? How or when did you feel ready to offer these advanced procedures to your clients? And any recommendations on CE courses you liked or any equipment must-haves once? I think I remember you guys mentioning acquiring cadavers for the cholecystectomy case you discussed. Cholecystectomy? Yeah. Sorry if this is awkward, but how did you acquire the cadavers? In regards to being a DVM mom, how do you overcome the mom guilt of maybe not being at all the family events but still being accomplished / fill your cup in the vet field? Any advice appreciated. Sorry if this is too long of an inquiry, but thank you if you made it this far. Thank you again for making this podcast, as it is helping me improve my clinical skills, but also my leadership skills. From Nancy M.
Great question.
Yeah. That's a big one to unload.
Yes.
Woo!
But it's a really good topic.
Woo.
I guess, King, you can speak more to, because we just started offering TPLOs at All Star. And so Dr. Cloud and Dr. Ham are the two that did a CE up in Utah. where they went to learn, right? Was it Utah?
Yep.
Down in Utah. I'm sorry.
Down in
that
Utah.
just triggered something.
Our famous traveler here.
Our famous
Well,
traveler.
it's like saying up in Kentucky,
I say it all the time.
and we're in Indiana.
Isn't Utah straight over?
I'm
No,
not
it's
sure.
over.
Isn't that
It's
deep,
over
Devin?
and down. Okay.
It's another
over and
failure
down.
of our school
Geographically
system.
challenged. Leave us alone.
Okay.
Okay.
Anyway, they went to sea in Utah and
Mhm.
they learned how to do it essentially, and they're doing it. So, do you remember the name of that? 'Cause she asked.
Nexus.
Sorry,
Nexus.
Nexus. Can
shampoo?
you spell that?
Nexus.
Okay. That's how it
Nexus.
sounds. Okay.
Modera is the company that all of our equipment came from for the TPLOs.
Okay.
And they also do stuff. But Nexus is the company that did the CE.
Okay. There you go.
So, and there are lots of great soft tissue surgical, like,
Conventions.
yes, thank you.
things.
Mhm.
Conventions that you can go to.
Wet labs, all that
labs
stuff.
and whatnot.
It's practicing, right?
Yes.
Like
hence
you
the
can read out
cadavers.
of you can read out of textbook how to do it, but
And I think the resources you guys have available are so different than when I graduated from
Mhm.
college, because you have YouTube, you have Instagram, you have the internet, you have, I mean, you have so many things. So to your point, like you can watch somebody do something, you can read it as
Mhm.
well, and then you get to practice it. And
Mhm.
so I think versus just having a person just show you or teach you,
Yeah.
which is also very helpful. But I mean, you don't always have access to those people.
no,
And you can't always go to a conference because you don't have the money to go to yet another conference.
right?
So I think, all of the things and resources available are really great for people. The Cadaver program was started for that purpose
Mm-hmm.
because we have so many veterinarians. How is it that Duckwall wants to learn how to do an enucleation, but
Mhm.
there's only one enucleation every so many months?
Right.
How does then Ham learn how to do it?
Yeah.
Or how does
Mhm.
Schmoke learn how to do it? So I think that was the goal behind the Cadaver program, was to make sure that everyone still felt like they were going to be able to learn what they needed to learn
Mhm.
to feel well-rounded.
Mm-hmm.
But then also then we looked at it as like an opportunity to learn new things, expand
Mhm.
not only what we know, the older people,
Mhm.
and teaching the younger people, but then just in general, like
Yeah.
what new can we learn? What
Yeah.
new things can we learn?
Mhm.
So we started that. We call it the All-Star
Memorial.
Memorial
program.
program.
Do you guys want to talk
So-
because you're the ones who offer it?
Yeah.
right?
Yeah.
Talk about what that conversation looks like in a room.
Sure. Okay, start.
more.
So typically it's part of our euthanasia protocol. So there's a lot of different things we go over for euthanasias. But we actually have a sheet that we go over with the owner. So the top part goes over legality things. So has the animal bitten anybody within the last rabies reasons. But then the second half goes over our All-Star Veterinary Memorial Program. And it is essentially the owner is donating their pet's body for teaching and learning purposes for the vet techs or veterinarians, whoever. They still get cremated in a timely manner if the owner wants the remains back and whatnot. But it's just a chance for them to learn. So we usually, if a pet is kindly donated to us, we let the clinic know. And then, like I said, we don't hang on to them too long because we don't want to be disrespectful to the family. We want their pet to be at rest. So we do what we need to do, and then we send them to be cremated.
Mm-hmm.
Yeah. So it's kind of like this is what the program is. Would you
Mhm.
like to donate your pet? And we actually have a generous amount of
Mhm.
clients who
Yes.
are happy
And
to.
it's really made a difference.
Yeah.
Yeah.
I mean, that's the only way we got to learn how to do the gallbladder surgery, because you never, how many you're going to be able to
Right.
practice before you do one, and I think that's with their TPLOs, same thing.
Yeah.
Mhm, mhm.
To your point of how many times, I think she asked, right, Duckwall, how many times before you offer these advanced?
Yeah.
Oh,
What was that?
yeah, like being comfortable. I
Like at what
think.
point do you feel comfortable?
When do you feel
offering
ready to
it?
offer these advanced procedures to your clients? So my always thinking is, if you're doing these things to begin with, like you're doing a PU, you're doing anal sacculectomy, you're doing a TCA, and other soft tissue surgery, you already have the dexterity and the hand-eye coordination and the skills, suturing skills to do things.
Mhm.
So like, I don't really see it that much different if you learn something new.
Mhm.
You already have learned the hard parts of certain.
Mhm.
Now you're just learning steps to performing a procedure and like kind of like the ins and outs of it. So I think Carla and I felt like okay, like once we finished 3, we were like, all right, these were pretty predictable, By the third one, we're like, looked like the other two.
Mhm.
Nothing surprised us. Okay, let's go ahead and do it. And I don't know if we did a fourth one or if the fourth one was the one that we were doing, like the live patient.
Sure.
So I felt like 3 times. I think with their TPLOs, I think that they've done. I think they did like
They did several.
3 legs each, and then like Carla went back and just this past week wanted to re-practice
Mhm.
some cutting,
Mhm.
like, cause she didn't feel like she was efficient enough so then she went back and practiced that particular part of the procedure. So I mean, I think that if you're doing it by yourself, that's a whole different ball game too. Instead of having like somebody be like, what do you think? Now, if you have another surgeon there, even though they don't know what you're doing, they still are helpful because do you think I need to worry about this? Do you think this? Do you think that? Do I have this closed crack? So I still think they're helpful as long as you're not like completely doing it yourself.
Yeah.
But
I mean, yeah,
what do
I
you
think it's, gosh, it's such a, I think a personal preference because it just kind of depends on how some people are like, okay, yeah, I saw you do it. I'm good. I'll do it. You know what I mean? Or some people just read out of the textbook and they're fine. But some people need a little bit more hand holding or just like that security blanket, whether
Mhm.
they're scrubbed in with you or just around. So I think, I mean, you're already doing intense things. I think that's
Right.
amazing.
Mhm.
So if you're comfortable doing those, how did you approach those things? Did you do a PU with somebody? Did you practice? You know what I mean? Like
Mhm.
if you are already able to do those things and you feel confident in it, well, why try to fix what's not broken? Just do the same steps.
Yeah.
And then, yeah, I think, I mean, we're always very honest or try to be. And so when you start to offer the services, say we're just now starting to offer them, but
Yeah.
I've done XYZ to prepare myself. And so if you trust me, I'd be happy to do it.
Yeah,
kind of
that's what I was going to say is that opportunity typically arises where someone can't refer.
Mm-hmm.
And those are like the best ones.
Yeah.
Because the owner understand, like everybody's on the same page.
Mhm.
Super,
Yeah.
So those are always great ones to start with where an owner can't go to the referral practice and you're like, all right, to have that conversation, you have that conversation
Yeah.
with them. And I think just trust your gut to your other point. Like if you're like, oh, I just don't know, then just do another one.
Yeah.
And so, yeah, trust your gut as well.
Yeah.
Confidence is key.
Yep.
Yeah. Okay. How do you,
DVM moms.
how do you overcome the mom guilt
Ugh.
of maybe not being at all the family events, but still feel accomplished and fill your cup in the vet filled?
I feel like this is good for both of you to answer because you're newer to it.
Mhm.
Yeah. So I have a 14-and-a-half-month-old and I came back from maternity leave knowing, and I already had the conversation with Dr. King, like my heart was not in coming back full time. So I don't know what your schedule is, if she's full time or not. And that's a very, very personal decision. That doesn't mean you can't do it all. I think that's a good segue for when Dr. King will speak to it. But yeah, I realized for me, I had to have more than just my one day off because I also have to take care of my home. I have to try to maintain my relationships, whether it's friendship, family. I'm a wife. I have to be able to do that. And life happens. So you're always pulled in 10 different ways anyways. Now you have this small human that you love more than anything.
Mhm.
So that was the first thing I realized I needed to do. And then I try to make sure I get my notes done in time to make it for bedtime. Now, obviously it's going to depend on your kids' bedtimes, but that is usually a priority. And if I have notes left over, I will do them after she goes to bed. So that's also where, again, are you okay with having work when you go home? Some people aren't. And some people then have to figure out if they're okay. Like, what's their priority? Is it breakfast time with them? My daughter likes to sleep a little more. So mine has to be bedtime.
Yeah.
And then I mean, it breaks my heart sometimes, sometimes there's really just the reality of like, well, I gotta work, or I gotta go do something because I still have to live all these other aspects of my life. And so like, when I'm at work, I'll pull up a daycare video or they send pictures, and you just balance it as best you can, and try to prioritize what in the season of life you're in with your kid's age, what is where you connect the most. And then saying no. You have to say no to things and just being like, nah, I'm not going to go do this with friends. I'm going to be home with my baby because I haven't seen her this much this week and stuff like that.
Mhm.
So,
Yeah.
that's kind of my biggest thing was part-time. I knew the moment I came back, before I even came back, I can't do it. I can't give my all at work, be exhausted as I am, try to recover on my day off, but it's really not recovering. You're still being a mom. So that's my insight.
Yeah. No, I get it.
Yeah. She gets it as well. She's got 5. I just got the 1 right now.
Oh, gosh. Transport back to...
Yeah.
I can't even imagine, going back and doing what we did. It was the best ever, but at the same time, I'm like, we were nuts. So the only way it worked was because Richie was willing to stay home, because we also had the added pressure of owning the business. So I think that there's so many things about, you miss so many things. And there's no way of, the only thing that worked for me was Richie's telling me what I was missing. So like saying, like, filling me in or making me feel like I was a part of it. And for me to be able to be like, I feel horrible because I'm never there. And him say, it's okay. It doesn't matter. It's going to be fine. Da, 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 da.
Yeah.
Or, but to have somebody else, I knew I definitely could not have somebody else taking care of them.
Sure.
That was going to be that I was not going to be able to focus when I was at work.
Yeah.
I knew that that's not what we wanted for our family. Like that for us was definitely not going to work. So, I don't know. I mean, I think, there were so many things that, I tried to, do things that would make me feel better about being away. So for example, but I mean, it was torture. I was the one who stayed up at night with the kids. So like when they would get up in the middle of the night, I always got up in the night with them.
Yeah.
But that's hard to do when you've just had a kid and now you're going back to work 3 weeks later.
Yeah.
And then staying up all night and then getting up and going to work and then I don't know how I did it. And then, so that was really hard, but that's how I made myself feel like I was a part of it.
Yeah.
So then it was worth it because then that was my time with them. And then as they got older, I did all of their extracurricular activities. So I did all their coaching. So that meant though that then I wasn't home at night. So whoever I was coaching, whether it was Harrison or Holden or whoever it was, then I was also not home then for the other ones that were there. Yeah. So then I would try and drag people along with me, to go to the coaching things or whatever. So I think, that's kind of how I filled my cup to know that I was still a part of what they were doing on a daily basis.
Yeah.
School things, Richie went to a lot of the school things. As I got further and further along, then I was able to step away. It was easier to step away, and go do those things or whatever.
Yeah.
But I wouldn't trade it back only because I think that the sacrifice put my family in a better place than had I not done it. So I do feel like my family's in a better place. And I do think that because Richie did what he did, then it all worked out.
Yeah.
I agree, because now you are getting all the time off that you deserve.
Yes.
Right. So then
After
it's
you
like,
built this amazing business, now you're like, okay,
yeah.
like I'm,
Yeah.
you've made
Like
So,
you
I
said,
mean-
if you say yes to things, you'll say no to things, but then it can still kind of come back around in a good way.
Yeah.
Like good karma.
Right. So, and I knew when I was doing this with my kids, I told myself I'm never not doing it with my grandkids. Like, okay, so like I gave that up, but I'm not giving this up.
Yeah.
Kind of a thing.
Yeah.
So I think that was a really, and I mean, like to your point, every time you say yes to something, you're saying no to something else. But that's what the family required. Like there was that was what was needed.
Right. And that's such a different
so-
scenario for everyone, like
Exactly.
And I think this question is kind of ironic because I actually have felt a lot of mom guilt today specifically. So context, today's Thursday. Tuesdays and Thursdays are my day off and we do our podcast on Thursdays. And so I have mom guilt when I have to drop her off on my day off when I feel like I should be with
there.
her.
Yeah.
But usually I'll get to my point. But anyway, today she had to get tubes in her ears. And so she had a little surgery, but it was our first one, new parents.
Yeah.
It was a lot emotionally and mentally. And we had 2 podcasts today. And so I'll be very honest, the whole way here, I was like, I don't want to stay for the second one. I want to go be with her. I want to be with my baby. And I came up with all of these things. But my point is like, if you have to choose, again, your priorities may be different, but if you end up choosing and you have that mom guilt, make sure it's for something you enjoy. Like make sure it's for something that you still fill up your cup with. And yeah, maybe work sometimes isn't the greatest. Sometimes we're like, I gotta, whatever, wake up early, whatever. But you still chose a career that hopefully you enjoy. And if you don't, figure it out. But I think that's ultimately, this is our second podcast. I decided to say, because I enjoyed this, I enjoy these people, and it does help with my mom guilt. And obviously I know she's with my husband and my parents right now, but it's just another way to say, okay, you know what? I decided to do this, but I'm going to go home and I'm going to focus on her for bedtime. And we had the time before this. And so that's my point, is just like, it's always going to be there.
Well, and that was the thing. That was the thing I always struggled with. It didn't matter. Even if I chose to go home because something happened, because I, wanted to be at home, now I feel guilty because I'm not at work. And then I'm at work, now I feel guilty because I'm not home. It's like never, like you're feeling guilty across the board. Yeah. So like, this sounds horrible, but learning to feel okay with those feelings is really where you're at. Yeah. And then deciding the non-negotiables. Yeah. So like if it's like, I'm going to be home before dinner for every birthday because I want to be there because of whatever the reason. It's a non-negotiable. Yeah. I think that also helps too.
That's a really good point, actually. Non-negotiables.
And it'll change throughout life anyway.
Oh, for sure.
Exactly. I think that's all we have.
Thank you for being here. We appreciate being here.
It's hard.
Fill your cup up.
Yes, you do. Keep on doing it, Mama. You're doing great.
Yes.
Oh, gosh.
You're killing it.
Okay.
All moms are killing it. Working moms.
You can do it.
Applause for working moms.
Yes. Okay. Close us out.
All right. Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
All right. Woo!
It's hot in here.